New York City health officials say they have found polio virus in the city's wastewater, and the state warns that based on these findings, the virus could be spreading locally. Last month, a 20-year-old man in Rockland County, which is north of the city, tested positive for polio and became paralyzed. It was the first confirmed case in the United States in a decade. Let's bring in Dr. Peter Salk. He is a professor in the Department of Infectious Diseases and Microbiology at the University of Pittsburgh School of Public Health. He is also the son of Dr. Jonas Salk, who developed the polio vaccine in the 1950s and essentially changed the world. I mean, this was a really deadly disease until Dr. Salk came up with this vaccine. So, Dr. Salk, how concerning is it to you that polio is back in the United States? I should note, as we did, that it has from time to time reared itself in this country as recently as 10 years ago.
Yeah, it's concerning. And the reason is that we are not as fully vaccinated as we should be in order to keep a barrier up against poliovirus coming back in and ending up spreading as we are just seeing now.
And I think some of the places that we have seen it, at least in the wastewater, these are areas where the vaccination rate is a little bit lower than it is in the rest of the country. And so, you know, the concern that people are going to have is, could this sort of broaden out into a larger outbreak? Do you think it could?
Well, I think that it's not likely at the moment to become nationwide, so to speak, because there are many areas in the country that really do have very good vaccination rates. Of course, the vaccination rates have fallen off over the last couple of years because of the COVID pandemic and people not being able to access the same services and so on that they had in the past. So we really have to keep our guard up. We can't relax in terms of protecting ourselves against not only polio, but other infectious diseases that are waiting in the wings.
So, Dr. Salk, do you think that we are, you know, there are often times when I look at Anne-Marie and I say, man, I wish I wasn't so old. But these days I feel like I'm lucky to be as old as I am because I know that I was vaccinated against polio. I know that I was vaccinated against smallpox. When we started talking about the monkeypox, I'm not sure that vaccine 100% protected you from monkeypox, but I was feeling very good about that. So the question is, I mean, do you and would your father have wondered if we've sort of let our guard slip in the last 20 or 30 years? It feels like when I was a kid, I was vaccinated against everything that could potentially happen to me. And it feels like now we're talking about people not necessarily being vaccinated against some pretty deadly.
And I think, Vlad, you know, on top of that, sorry, doctor, is, you know, what we've seen in maybe in the last 10 years or so is this rise of the questioning of vaccines, the questioning of science. Is it valuable? Are there effects that we haven't researched properly? All that sort of stuff. I wonder how your father would feel about all this conversation.
Yeah. Well, when we look back to the 1950s, this was a huge national concern. Parents were terrified. There was no way of predicting when a polio outbreak would start, who would be affected, whether your child might end up paralyzed or even killed. This was something that was on every parent's mind. And the development of not only the first vaccine by my father and his team at the University of Pittsburgh, but also the second vaccine by Albert Sabin and his team at the University in Cincinnati. Those were funded by the National Foundation for Infantile Paralysis, the March of Dimes, and the funding came from millions of people in the United States. This was not government-funded research. It was the people's success in providing the money to get this job done.
Yeah, and I guess, you know, we're still able to develop these vaccines quickly in this country, so I'm heartened by that. President Trump implemented Operation Warp Speed. We had the vaccines in record time for COVID, but it does seem, as you pointed out, Anne-Marie, that people have become more resistant to the idea of vaccinations. And I just think to myself, I sort of credit science. I credit your father. I credit all the doctors and scientists who were able to come up with these vaccines. I mean, I remember when I was a little kid and I stepped on a rake and I thought, because I was that kid who was a hypochondriac, and I thought, I'm definitely getting tetanus. Yeah, I'm getting a tetanus. Yeah, I'm going to get gangrene, Mom. My leg's going to fall off. And she was like, what do you, no, because, and in my parents are immigrants. In the countries that they came from, they didn't have access to these vaccines. So a lot of people died. A lot of people were stricken by polio. And I was blessed to be born here and not have any of those
But
issues.
you know what I
doctor.
think was quite stunning is the doctor, describing how everyone was on the same page with polio.
Yes.
Every parent
You get
was
celebrities,
concerned.
Elvis,
Right.
talking about it.
And fast forward to now, and you would think a global pandemic would be enough to sort of bring everyone together on the same page, and instead it's had the opposite effect in many places. But this conversation about vaccines and questioning vaccines was happening before the pandemic.
True.
But it's sort of stunning the difference that you describe, when everyone was getting that polio shot.
Yeah. Well, the culture has changed and the people's experience has changed. Infectious diseases have been largely brought under control. We're living in a different world than we were back in the 1950s, where people had these all around them and were terrified. So it's natural for people to think, oh, these are not really problems, and I don't really need to get my children immunized. If there's any risk whatsoever, better to avoid it. Let somebody else have their children get immunized, because if enough children are protected, then that will protect everyone else, and I'll take a free ride. I just don't think this is a very good social stance to be taking in this day and age.
Yeah, great point. Dr. Peter Salk, thank you so much for joining us.
It's a pleasure to be here. Thank you.